The people who should see it, though, are the health system administrators. So
Yep.
the ministries of health and the bureaucrats that have been managing the financial resources to make it work for a very long time. Doctors may be persuaded by data. Are these administrators equally persuaded by data, or is there something else that we need? So do we need patients to be going to them and saying, listen, we've had enough. What you're doing today is not enough for us.
Absolutely. And I think that that's why patient advocates in Canada have been leading the value based healthcare transformation because we're demanding it on behalf of the patients that we represent. And when it comes to politics, I don't think politics are good or bad. I think it's like the force. And I try to be a Jedi, you know. You don't always see are the dark Sith lords, but actually if we actually influence politicians by telling them, look, this is what your citizens want and need, and this will make you look good. So, you get to do good and look good, and ultimately everyone wins. Let's go in that direction because, and that's why we have to tie in those economic arguments. That's why we need to tie in, like, this is what people need, and this is why. Because the metrics that they're used to using are obsolete. I don't think that they serve our needs anymore.
Yeah.
That's what we had because it was the best that we had. Fine. But we're in 2024 now. Let's get with the times. Our IT systems are also getting better and hopefully they will continue to get better. So we can do things now that we couldn't do before, but we really need to kind of rattle them a little to make the decisions that are best for the population. And the only reason that they will do that is if they're incentivized by real patient stories, real communities getting together and saying, hey, it's not enough to give us the cheapest thing, or it's not enough. Like, we don't want austerity measures. We're all traumatized all across the country on austerity measures in the healthcare. So how can we actually do better, not have to send our cancer patients to the United States, like in British Columbia, for example, or at one point we had to do that in Quebec too. How do we actually deliver the best to our population within our capacity to pay, and then showing the population that what we're investing in actually makes them better. And I think what we're missing too is like more investment in primary care and early detection and screening, demonstrating that that's really much better for patients and families, but it's also better for the system because we know it theoretically, but we've never done that. I mean, we saw during the pandemic how underfunded public health was. And so I think that, flipping that model right now, the pyramid, of our investment is like we spent the most in hospital care, then a little bit in chronic care, and so little in primary care, right? But if we what we need, what the patient population needs or the community needs is more in prevention than medium level in chronic care and maintenance, and then only a little bit in acute care because ideally less people would have to get there because we did such a good job preventing things in advance. And so that's also a mind shift. Like, what do we spend money on? But politically, it's more sexy to build big hospitals and buy MRI machines than to spend a lot of money in prevention that takes years and years to show results. But we'll never know if we don't measure. And so you can only improve what you measure. That's where we got to start.
So, so what I hear is less ribbon cutting and
Yeah.
more healthy people.
Exactly.
This
And
is
you know
what we
what?
really want.
Show me the data. Show me the data. Like, show me that people are doing better. Like, hold me accountable for a healthier population. Let's lower mortality. Let's improve the lives of people that have chronic disease. Let's take deadly cancers, make them chronic, and then chronic and make them curable. But show me the data, and let's judge our politicians based on how healthy they make their population and not just the ribbon cutting ceremonies.